the spinal nerves. Okay, from here, the spinal nerves are going to exit the vertebral canal. Okay, so the vertebral what? Canal. This is a canal. The vertebral canal is bigger. The vertebral canal houses the spinal cord. The spinal cord, it's a cord, it's big, it's in the canal. However, the intervertebral foramina here, which was formed when we had communication between the facet joints, converting this into a foramina, that is going to be for the exiting of the spinal nerves. So the spinal nerves, right and left, are going to exit through the intervertebral foramina. All right, perfect. Now we need to differentiate between the different regions of the vertebral column. We have the cervical region, we have the thoracic region, and we have the lumbar region. Otherwise, we have a full sacrum. So we're not going to talk about the sacral vertebrae because they are atypical and they are fused together forming the sacrum. But we need to differentiate between the cervical, the thoracic, and the lumbar. How can we differentiate? First of all, if you look at them, of course, they're going to get bigger, right? So the bodies are going to get bigger, all right? If you look at the body, it was small here, medium here, and large here. The shape here is gonna be for the body, it's gonna be concave from above and convex from below. All right, here it's gonna be heart shaped, and here it's gonna be kidney shaped. And I made you some shapes to help you remember the shapes of the bodies. Now, what about the canal? If you look at the canal here in the cervical region, it's gonna be big canal. The vertebral canal here is big. The vertebral canal here is small, and here it's intermediate. Okay, all right. So here it's the biggest because the vertebral body is the smallest. All right, and here it's gonna be small in the thoracic region, and here it's gonna be bigger. Here, because we have cervical enlargement, the spinal cord is enlarged in the cervical region, and it's also enlarged in the lumbar region. Why? Because the cervical enlargement will give me plexus. Remember the cervical and brachial plexus? So the spinal cord segment is thicker at this region. And also here, it's going to give me plexus, the lumbar and sacral plexus. But here it's going to be small because it's only for the thoracic muscles. Okay, so in the thoracic region, the canal is the smallest. Here it's circular, here it's triangular, and here it's also intermediate. All right, now, there are some specifications in the vertebrae. And remember our golden sentence, which is the structure explains function. Always remember that whenever you are studying something in anatomy and you need to differentiate between things, think about the function and how the structure will help to do that function. It's going to be what you need to memorize and study in anatomy. Now, if you look at the cervical region, you're going to have something that will distinguish the cervical from the thoracic and the lumbar. What is it? It's what we call the foramen transversarium. It's what? It's the foramen transversarium. Why do we call it foramen transversarium? Because it's in the transverse process, right? Why do we need it? Because we have something called vertebral artery. You guys have your heart in your chest, right? And then you have the aorta, and then you have on the right side, you have the brachiocephalic, on the left, you have common carotid and subclavian. And from the subclavian, all right, here, you will have vertebral arteries. From the subclavian here, you have the vertebral arteries. The vertebral arteries, you guys, this is your neck region, right? And this is your head. Let's suppose that this is your head, cutie girl, and this is my neck. And this is my chest, right? Now I need to have the vertebral arteries all the way to supply the brain. So they need to run in a specific place. So thanks for the foramen transversarium in my cervical vertebrae that are going to house my vertebral arteries, right? So because we are in the neck region, we need vertebral arteries to run all the way from the thoracic cage, from my heart, all the way up to the brain. I need a space for the vertebral arteries. So I have foramen transversarium. Another thing that distinguishes them from the others is that we have short spinous processes, all right? These spinous processes are short and they are going to get longer as we get to the thoracic region. And here it becomes bigger and broader. Everything is the biggest in the lumbar. Remember that. It's always broad. Another thing is if you look at the articular facets, it's going to be superior and inferior here. However, as you get down in the thoracic region, it's going to be medial and lateral. All right, here and there, the facet joints, the articular facets are going to be medial and lateral. All right, so what makes that cervical region different is the foramen transversarium, of course, the smallest of everything except the canal itself. And as we proceed, we will find that the thoracic has something different. What do you think you guys gonna find in the thoracic region? First of all, the spinous process is directed downward. Why do you think this is important? It's directed downward, you guys. If you look at the thoracic region, you guys don't want to have a lot of extension because you need to protect your organs inside. So this downward, if you have a downward spinous processes, if you need to do extension, it's going to be limited by the following spinous process. So that explains why the spinous processes are very long here but directed downwards, because as you do extension, they are going to stop you from doing further extension to protect your vital organs and chest cavity. All right, now let's get back to this. And also here we have articular facets on the transverse processes, here on the transverse processes and the pedicles, because here we will have the ribs. And if you guys need to know more details about the thoracic vertebrae, please go ahead and watch the anatomy of the thoracic wall. I'm going to show you how does that video shows. And this is going to be in the respiratory module. I explained the thoracic vertebrae into so much details and how there is a difference between the atypical and atypical ones. You guys can go ahead and watch that video if you really need to know more information about the thoracic vertebrae and why do we have these facets and how do they connect to the ribs. And the final thing here is the lumbar vertebra, all right? And that is how having the bigger body, of course, because this is where you have all of the weight of the stuff in above. And here things are going to be shorter. So the transverse process is going to be shorter and the spinous process is going to be shorter than the others, right? And these are going to be the classifications. And like we said, the body is the biggest because it's carrying most of the weight of your body. So remember that the specifications of each one of them, and of course, I'm sure the other things are easy, and this is a nice table that can help you to study the differences between the vertebrae. Now, when we talk about the vertebrae, we need to know that we have typical and atypical in each one of the regions. And where would that be? Remember that always, always the first and the last vertebrae of each group are gonna be different. Why? Because they want to follow the next group. Great. Now let's talk about the cervical region. The cervical region is actually C1 all the way to C7, all right? And because the head is on the top, this is your head. Okay, so of course C1 and C2 are gonna be different. Why? Because we have important functions. And we're going to talk about that now. So C1 and C2, which was what we call the axis and atlas, are going to be different than the others. And C7 also is going to be different. And it's going to have a prominent spinous process, which is important in the clinical examination if you want to palpate for the neck and count in that patient, because you need to see where is the problem in his neck. C7 spinous process is the most prominent one in the neck. And sorry, I forgot to bring a picture of that, but you can just Google that and see it. You just Google C7 prominent surface anatomy, and you will see a lot of neck pictures showing you how the C7 spinous process is most bulging. And that's why this is the last one of the cervical group. And the first two of the cervical group are atypical as well. Why are they atypical? Because they need to help you to do your movements of your head. Movements of your head are different from everywhere else in the vertebral column. Like what? Now let's talk about first C1, and then we're going to talk about C2. What happens in C1 is what we call it the atlas, okay? The atlas is the first, C1 is the first vertebra in your body. It comes after your the occipital region, the occiput of your skull, all right? So of course you're gonna have articular surface to accommodate your occipital condyles, because you guys know that your cranium rests on the top of C1. So the different thing we have in C1 is that we have superior articular surfaces for the occipital condyles. This is number one. Number two, the atlas does not have a body. But where is its body? You can think about the atlas as someone who stole the body of the atlas. So axis, sorry if I said atlas, the axis, which is C2, and it has an axis, which is the odontoid process or the dens of the axis. Let's say that it stole the body of the atlas here. So here, we don't only have a body for the axis, we also have the body of atlas here. So here we don't have body, the atlas does not have a body, and instead the axis has a body and the body of atlas, which is the dens of axis. But please, in the exam, don't write the body of atlas. You need to say the dens of axis, or you can say the odontoid process. Don't say the body. I'm just trying to help you out to remember the features of C1 and C2. So here we don't have body. Other than that, we have something called lateral masses, okay? We have lateral masses. The transverse process here is quite different. It does not look like the transverse processes we know them. And because we don't have body, we have these lateral masses, okay? And then we have posterior arch and anterior arch, all right? So this is how the atlas looks like. No body. We have the surfaces that will articulate with the occipital condyles. We have two lateral masses. The transverse processes are a lot different. They are only there because they want to give a passage for the vertebral arteries in the foramen transversarium. And then we have posterior and anterior arches. But the axis has more or less the same features of the other cervical. It has a body, it has laminae, it has a spinous process pivot, it has transverse processes, of course, from transversarium. But plus we have the dens or the odontoid process that gets inside the foramen, which is surrounded by transverse ligament of atlas. This transverse ligament is very important, and if we have a fracture in that, that will cause subluxation. It's a very serious condition. All right. So this is a very important ligament, and it comes frequently in examinations. All right. For the axis, we also have the odontoid process. Now, that will take me to the next point, which is the joints between them. So now we have three important things. We have the occipital condyles that articulates with the axis, and that will give me atlanto-occipital joint. And I also have the odontoid that gets into the foramen of the atlas here. We call it foramen for dens of axis. And that is wrapped around by the transverse ligament of atlas. And we have here also superior articular facets because we need to articulate with the atlas. And that will give me the atlantoaxial joint. So we have atlanto-occipital joint, we have atlantoaxial joint. Now, if I want to look here, I have, this is the axis, the atlas on the top. So this is atlanto-occipital above, we have atlanto-axial joint. What happens in atlanto-occipital? Atlanto-occipital will help you to do which function? It's to do yes in all languages. It's the nodding, you want to say yes, and it's moving your head right and left to say yes in Indian language. However, The atlantoaxial joint, it's where when you rotate your head and say no. Okay, so between this and this, you say no. And between this and this, you say yes in all languages, which is the nodding function and the side flexion of your heads, the side flexion of your heads. However, the no function is by rotating your head, rotating. How will you remember that? Remember that here you have the odontoid process. The odontoid process is an axis that gets into the foramina of the atlas, right? So that will help you to rotate. Yeah. Whenever you have an axis, it means that there is rotational movement. It's gonna rotate here, right? It's gonna rotate. So to say no, you need to rotate your head. So that is gonna happen in the atlantoaxial joint. And the opposite is true. The yes, nodding, and side flexion is gonna happen in the atlanto-occipital joint. All right? Now, of course, here is the sacrum. It's fused, and the coccyx, they are fused. They have foramina because they will let the sacral nerves come out of them, sacral spinal nerves. And then they have the body, and then you have the promontory, and that is going to be explained into more details and all these features of the sacrum above in the it's already explained in my channel and the reproductive module, the pelvic region. And but it's just quite easy. You have foramina, and that will be for the exiting of the sacral nerves. Now, here coming to the next point, it's the intervertebral discs. What does the intervertebral disc do? They connect your vertebral bodies together. How are they formed of? They are basically formed of two important parts: the annulus fibrosus outside and the nucleus pulposus inside. The nucleus pulposus, the word pulposus, it means kind of gelatinous material. And the name fibrosis means it's something fibrous. It means it's tough. You guys know, if you just dissect and see a fresh disc, the annulus fibrosus is going to feel like the shrimp, the body of the shrimp. So this is actually the fibrous part outside. We need to give support, but at the same time, we need to have a firm kind of support because we don't want this gelatinous material to come out of its place. And that happens whenever we do wrong movements to our bodies. And whenever we get cracks, God forbids, if we have cracks in the annulus fibrosus, the gelatinous material can ooze out of it, and that is going to happen mostly in the posterior side, and that will compress on the spinal cord, like we mentioned previously. And in that case, they will do the laminectomy. Remember, that was our lamini, and they're gonna remove this bone to do decompression on the spinal cord. And that's because the gelatinous materials comes out of the cracks of the annulus fibrosus, and if it touches the nerve, it's gonna be very painful, and it can cause limitations in the motor control, and it's gonna affect the motor neurons coming out of the spinal cord. It's gonna affect the function. So this is how the discs are formed. And why do we need it as gelatinous material? Because that will help me to bend my body. Yeah, because I need to bend my body, and in order for that to happen, I need to have some structures, some soft structures between my bony parts, so that will help me to bend my vertebral column. Now, what happens if we don't lift heavy objects in a correct way? Actually, this is just a bonus information to protect your backs, and you just go ahead and show people that you have learned a new information here. Is whenever you need to lift a heavy object, you need to keep your back straight, and you need to bend your knees instead. Because if you lift a heavy object and you put all the pressure on your back, that's gonna cause cracks in the annulus fibrosus, and that will cause the nucleus pulposus to bulge out of it, and that will cause you disc prolapse. And in that case, if it's if at an advanced stage, that will need to have, like we said, laminectomy and decompression. And it's a serious condition with the symptoms and signs and back pains and the hernia, and that you don't want to have it for you or your beloved ones. So take care of your back and keep your back always straight. So what happens if we have the hernia? Like I said, the gelatinous material inside, which is the nucleus pulposus, is gonna compress on the spinal cord, and that can cause compression on the nerve. Now, if you have an exam question and they will ask you if there is a herniation at the level of L4, L5 disc, it means that L5 nerve is affected. So remember that if my problem is, if this is L4 and this is L5, all right, and I have compression here, it means this is the problem of the lower nerve, because your nerve runs lower to the level of the disc. Okay, so remember this information. And yeah, like this is what I was trying to explain to you guys regarding the laminectomy. This is exactly what they do, and this is exactly what happens if we have compression because of the disc prolapse.